Good morning, friends. I am Dr. DK Rai. Today I am going to talk about most crucial aspect of concern of parents suffering from autism child. That is, can autism be cured? When parents are coming and when they are aware that his or her child is having autism, and then they know that mild, moderate, or severe, then next question is that can autism be cured? Is my child will become normal? Is my child will become a normal school child? Then it can be cured or not is a very complex and difficult question to reply because various perspective therapies and research understanding the possibilities and limitations that is crucial for replying this question. There is first I would like to say, and definitely sorry to say, but this is a fact and reality that there is no known cure for autism spectrum disorder till date. Then what should we do? Should my child live on his or her own fate? No, you should not leave your child on his or own fate. Child autism cannot be cured, but it could be improved to a great extent by early intervention and proper therapies and proper care. The child quality of life can be improved to a great extent. If you will work hard, your child will improve and get better. So that you should not lose the hope in by listening that autism cannot be cured. Be positive, start working hard on your child, and you will get the result as an improvement in your child, and quality of life of your child will definitely improve. And you are not alone, we are also with you to support and guide. Autism is a complex neurodevelopmental condition that is believed to have both genetic and environmental factors contributing to its development. It is not a disease that can be cured in the traditional sense. Early intervention, specialized therapies, and support services can significantly improve the quality of life and outcome of individuals with autism. Early diagnosis and intervention can help children develop essential skills, improve communication, and gain more independence. Therapy and therapy is helpful in this are number one is behavioral therapy. As you already aware about ABA, applied behavior analysis, and other behavioral interventions can help individuals with autism to acquire new skills and reduce challenging behavior. What is applied behavior analysis? You have to apply the knowledge and skills to modify the behavior of your child by giving reward, a reinforcer. It may be his or her favorite toy, his or appreciating, giving high five, or clapping. Means in a applied behavior analysis, which is considered as a gold standard for treatment of autism, and in a basic sense. I am not saying that in detail, but in a basic, just to understand as a general people that applied behavior analysis is just giving and motivating the child through reinforcer or reward by clapping, high five, or giving his favorite toy, favorite thing to eat, so that child could do the desired behavior. And if child is not doing the desired behavior, then you could give the prompt or support. It may be physical or verbal, and you can do the modeling. That is, you can show to demonstrate how your child should do and show that he could copy the things and then he could learn that skill. Other is speech and language therapy, as you already aware that this therapy can help individuals in a communication difficulties. Other is to improve their language and social communication skills. Next is occupational therapy. It will help in developing gross and fine motor skills, activity of daily livings, and other things like occupational therapy will teach your child to hand washing, brushing, and other skills. and motor skills like walking, running, and other if your child is having any problem in these issues. Then social skill training. These programs aim to improve social interactions and relationship with others. Then special education. It should be tailored education program often with individualized educational plans. Means IEP, individualized education plan, which involve the special educator, parents, and a teacher. Child with autism access appropriate educational services. I will discuss IEP in detail in other videos, but I would like to brief only here. Then other is the medication. Medication may be prescribed to manage specific symptoms or comorbid conditions such as anxiety or attention deficit, because child with autism is having other issues also, and people are thinking that my child is having autism so that I should not give any medication. But autism is one thing, and other co-associated comorbid conditions can be treated and can be managed, so that if you want to improve the quality of life of your child, then you have to go and assess for the associated medical conditions. I will discuss it in detail in other video, but your child may have a seizure disorder, your child may have a hyperactivity, sleep issues, digestive problems, or other issues which can be treated medically, and it will help in improving the quality of life of your autistic child, so that you should not avoid medical management of your autistic child. Then supportive services, social services, community programs, and support networks help individuals with autism and their families. Many Facebook groups and other NGOs are helping these parents, and some government is also supporting and helping in some countries, and in some countries have made the national autism care plan also, like USA, Singapore, UK, Australia have national policy also on autism. Focus on the unique abilities and strength of individuals with autism rather than seeking a cure. The focus on you should means you have not to go for cure of autism. How my child will be cured, and if someone is claiming that I can cure, you should avoid that place, because if a child cannot be cured, autism cannot be cured, then why you have to go here and there just on the basis of any claim? So that focus on providing the necessary support and accommodation, help individuals with autism to improve the quality of life and live a fulfilling life. Autism is a lifelong condition, and the goal is to maximize individuals' quality of life and well-being. And early intervention and therapies can significantly improve an individual's quality of life. Autism is a unique part of one's identity, and by focusing on support, acceptance, and individual growth, we can ensure a brighter and more inclusive future for those on the autism spectrum. Thank you for watching, and we will meet you in the next video.